Hey guys, Dr. Ben Schurhamer here at Penn Medicine. Just hoping to give you a few seconds here to go through your multiparametric MRI results. First thing I want you to know is, thank you for going through the process of getting that test. We understand that it's a big cost of your time, and maybe it's uncomfortable to sit in that tube for an extended period of time, and so we understand there's a big investment that goes into it. So certainly the radiologist, when they look at your results on the backside, go through a lot of different sequences and phases to make sure that they're getting all the information possible out of your scan. So first, just thank you for doing that. So when you get your result on mpMRI or whatever your smart phone has, you'll see a few different things. So the first thing that will generally be listed is the PIRADS lesion. The second thing that's listed is generally, whether or not there's any sort of extra prostatic bulge. And then the last thing is generally the size of the prostate. And that's how our radiologist listed here. What you'll find is that for the PIRADS lesion is listed as the first thing there, and I've highlighted that in yellow. And so this person has a PIRADS 4 lesion, and I've got their permission to share this, but also deleted some things just to kind of make sure to share some confidentiality. So you might be asking, what does a PIRADS lesion mean? PIRADS score is an international score that was developed so that every radiologist in the country that looks at these studies will have a standardized way to share what they found. And so here, what you'll find is PIRADS 1 and 2 are essentially benign findings. And we zoom in on PIRADS 3, 4, and 5 as workup in terms of screening for and treating possible prostate cancer. So if you have a PIRADS 3, 4, or 5 lesion, what that means is that if there's a PIRADS 3 lesion, there's a roughly 20% chance of us finding something what we call clinically significant on biopsy. PIRADS 4, that goes up to about a 50%, and PIRADS 5, that goes up to about an 80 to 90% risk. PIRADS 0 to 2 show no increase in risk over just a standard 12-core biopsy, and so those lesions are generally not targeted out specifically. If you have a PIRADS 3, 4, or 5 lesion, what we generally do, unless under surveillance, is recommend an MRI fusion or cognitive biopsy. And that's where either the ultrasound tech or us as trained urologists will actually target the area on the biopsy that was found on the MRI and take some extra specimens of that area to make sure that there is that we have an adequate sample. You may be in the situation where we actually did not find anything on the MRI, and just to be totally clear that the MRI test is not perfect. It does miss some cancerous processes, and so what we find is that it may miss between 10 and 20% of possible prostate cancers. And so in general, based on some clinical characteristics, we may still recommend to go ahead with a standard 12-core biopsy, even if the MRI was negative, just in case there's other clinical characteristics present. You may be asking, what do I do next? And I think the best thing is just to go ahead and contact your care team about either scheduling a consultation with your referrer for your multiparametric MRI of the prostate. Maybe you feel comfortable with at that point, just go ahead and scheduling a prostate biopsy, or just contacting your physician about the next steps. For us here at Penn, we favor using mpMRI. It just allows us to communicate with you in just such a much more efficient way. So I hope this kind of helped clear things up. And again, thanks for getting that study. And we look forward to continue to work with you. Thanks.